Hello and welcome to Healthy Life Channel, where we explore vital topics to keep you well informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. In today's video, we'll explore 8 commonly used supplements that may be harmful for individuals with kidney disease. These supplements, often considered beneficial, can be surprisingly dangerous when kidney function is compromised. Stick with us until the end, as number 2 might genuinely surprise you. Kidneys are vital organs, responsible for controlling blood pressure, producing red blood cells, and maintaining bone health. But when kidney disease develops, this complex filtration system starts to fail. Waste can accumulate, leading to various serious health problems, often without symptoms in the early stages, earning kidney disease the nickname silent disease. However, as it progresses, symptoms like fatigue, swelling, itching, and muscle cramps may appear. Causes of kidney disease vary widely, from genetic factors to conditions like diabetes and high blood pressure, and exposure to toxins or injury. If left untreated, kidney disease can lead to severe complications, including cardiovascular disease, bone disorders, anemia, nerve damage, weakened immunity, and ultimately, kidney failure, requiring dialysis or transplant. For people with kidney disease, the balance of waste filtration and mineral regulation becomes challenging, making some commonly safe supplements risky. Today, we're detailing 8 supplements that could pose health risks to individuals with kidney disease. Our goal isn't to alarm you but to help you make the best health decisions. But first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Let's begin. 8. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs, or non-steroidal anti-inflammatory drugs, are widely available pain relievers and anti-inflammatory medications, including ibuprofen, naproxen, and high-dose aspirin. While effective in reducing pain and inflammation, they carry significant risks for individuals with kidney disease. NSAIDs work by blocking enzymes that promote inflammation, but this can reduce blood flow to the kidneys and lead to acute kidney injury or worsen existing kidney issues. Additionally, NSAIDs may cause fluid retention and elevate blood pressure, potentially interfering with the effectiveness of blood pressure medications commonly prescribed to kidney patients. The risks of using NSAIDs increase with higher doses, prolonged use, and pre-existing kidney conditions. Kidney damage related to NSAID use may present symptoms such as reduced urine output, swelling in the extremities, shortness of breath, and confusion. Long-term NSAID use can contribute to chronic kidney disease progression, particularly in vulnerable populations. For kidney disease patients, safer alternatives like acetaminophen may be recommended for pain relief. Additionally, non-drug pain management strategies such as heat therapy, physical therapy, or acupuncture can offer relief without harming the kidneys. In cases where NSAIDs are necessary, such as for intense pain or high fever, close monitoring and limiting the duration of use are essential. It's also crucial for kidney disease patients to recognize hidden sources of NSAIDs in over-the-counter medications by reading labels carefully. Regular kidney function monitoring is advised if NSAIDs must be used. By understanding the risks associated with NSAIDs and exploring safer alternatives, kidney disease patients can better manage pain without compromising kidney health. Managing kidney disease involves careful consideration of medications and supplements to protect overall health. 7. Protein powders. Protein management is a critical aspect of care for individuals with kidney disease, as both too much and too little protein can lead to complications. Protein is essential for functions like tissue repair and immune support, but its metabolism creates waste products that compromised kidneys struggle to filter effectively. For those with kidney disease, high-protein supplements, such as protein powders, can increase the workload on the kidneys, potentially accelerating kidney damage and causing symptoms like nausea, fatigue, and muscle weakness. Additionally, many protein powders contain high levels of phosphorus and potassium, which can pose added risks for kidney patients who must carefully monitor these minerals. The right amount of protein varies based on the stage of kidney disease and any treatments in place. In early stages, a moderate protein diet may be recommended, while later stages, especially for dialysis patients, might require higher protein intake due to protein loss during treatment. This variability emphasizes the importance of consulting a renal dietitian to determine individual protein needs and avoid the complications of both high-protein supplements and inadequate intake. Often, kidney disease patients are encouraged to get protein from whole food sources like lean meats, fish, eggs, and legumes, depending on potassium and phosphorus levels. These foods provide a more balanced intake, offering protein along with other essential nutrients without overloading the kidneys. Regular blood tests are essential for assessing how well the kidneys are managing protein waste products. Markers like blood urea nitrogen, BUN, and creatinine levels help guide adjustments to protein intake. Special considerations should also be made for patients with diabetic kidney disease, those undergoing dialysis, and individuals following vegetarian or vegan diets. Physical activity, while beneficial for kidney health, can influence protein needs, so any new exercise regimen should be discussed with healthcare providers to ensure appropriate adjustments to protein intake. In summary, managing protein intake in kidney disease is a complex task requiring individualized attention and regular monitoring. High-protein supplements are generally discouraged, and balancing protein intake through whole food sources under the guidance of a renal dietitian can support overall health while protecting kidney function. 6. Mineral supplements, phosphorus, magnesium, and calcium. Managing minerals like phosphorus, magnesium, and calcium is essential yet challenging for individuals with kidney disease. These minerals are critical for bodily functions but can accumulate to dangerous levels when kidney function is impaired. Phosphorus supports bone health and energy production, but in kidney disease, it can build up to toxic levels. Elevated phosphorus can lead to weakened bones, blood vessel calcification, and cardiovascular issues. Patients are often advised to limit foods high in phosphorus, like dairy and processed foods, and may require phosphate binders to control levels. Processed foods are particularly tricky as they often contain hidden sources of phosphorus. Magnesium is important for muscle and nerve function, but excessive magnesium can lead to symptoms like muscle weakness, breathing issues, and irregular heart rhythms, especially in kidney disease patients. This mineral should be carefully monitored, and in some cases, intake might need to be limited to prevent complications. Calcium balance is tightly linked to vitamin D metabolism and overall bone health. Kidney disease can disrupt calcium regulation, leading to either high or low calcium levels, both of which carry significant health risks. Elevated calcium levels may cause blood vessel calcification and increase cardiovascular risks, while low calcium levels can weaken bones. Calcium supplementation in kidney disease patients requires caution and professional guidance due to these potential complications. A tailored diet plan from a renal dietitian is crucial in managing these minerals safely. Working closely with healthcare providers, kidney patients can monitor their blood mineral levels regularly, which is essential because mineral imbalances may develop without noticeable symptoms. As kidney function changes over time, patients may need adjustments in their mineral intake, dialysis plans, or medications. In kidney disease, achieving mineral balance is essential but requires precision, as either excess or deficiency can have serious consequences. 5. Excessive vitamin A. Vitamin A is essential for several key functions, including vision, immune response, skin health, cell growth, and reproductive health. It is available in two primary forms: preformed vitamin A, retinol, typically found in animal products, and provitamin A carotenoids, found in plant-based foods like carrots and spinach. Under normal conditions, the body carefully regulates vitamin A levels, but this process can become disrupted in individuals with kidney disease, leading to an increased risk of toxicity or hypervitaminosis A in healthy individuals. The kidneys help remove excess vitamin A and play a role in activating vitamin D, which, along with vitamin A, supports calcium balance and bone health. In kidney disease, this regulatory function is often impaired. As a result, individuals with compromised kidney function are at higher risk of vitamin A toxicity even at doses that would be safe for those with normal kidney function. Excess vitamin A can cause symptoms ranging from mild, nausea, headaches, to severe, including blurred vision, skin changes, joint pain, and liver issues. Over time, vitamin A toxicity can lead to serious complications such as osteoporosis, liver damage, and, in cases of excessive intake during pregnancy, even birth defects. This is particularly concerning for kidney disease patients, who may already face risks related to bone health and other complications due to reduced kidney function. For most people with kidney disease, vitamin A supplementation is generally not recommended unless prescribed by a healthcare provider. Instead, obtaining vitamin A from dietary sources, such as sweet potatoes, carrots, spinach, and mangoes, is typically safe and beneficial. Beta-carotene, a provitamin A found in plants, is considered safer because the body only converts it into vitamin A as needed. Balancing vitamin A intake requires careful individual planning to avoid potential risks while supporting the vitamin's essential roles in health. 4. Potassium supplements. Potassium is an essential mineral that supports heart and muscle function, nerve transmission, and blood pressure regulation. However, managing potassium intake is especially important for individuals with kidney disease due to the kidney's role in filtering and balancing potassium levels. Here's why potassium can be problematic and what kidney disease patients should know. In healthy kidneys, excess potassium is efficiently removed from the blood. However, impaired kidneys may struggle to regulate potassium, leading to a dangerous accumulation in the blood, a condition known as hyperkalemia. This can cause severe symptoms, including muscle weakness, abnormal heart rhythms, and, in severe cases, cardiac arrest. Hyperkalemia can sometimes present with subtle or no symptoms until potassium reaches critically high levels, making regular monitoring crucial. Potassium supplements are generally not recommended for kidney patients, as they can quickly raise blood potassium to dangerous levels and potentially interact with medications commonly used for kidney disease. Some salt substitutes, herbal supplements, and over-the-counter medicines may contain hidden sources of potassium, adding to the risk. For kidney patients, potassium intake is usually managed through diet rather than supplements. Patients with kidney disease may need to limit foods high in potassium, such as bananas, potatoes, dried fruits, beans, and leafy greens. However, completely avoiding potassium isn't advisable, as some potassium is still necessary for health. A renal dietitian can help create a balanced diet to ensure that patients receive the right amount of potassium without raising health risks. Kidney patients often undergo regular blood tests to monitor potassium levels. If levels rise too high, doctors may prescribe potassium binders, diuretics, or, in severe cases, emergency dialysis. Careful potassium management is an essential part of kidney disease care, helping to prevent complications and maintain overall health. For individuals with kidney disease, managing nutrients like vitamin C and potassium is essential to avoid potentially severe complications. Always consult with healthcare providers for guidance on supplements, diet, and medications tailored to individual kidney health needs. 3. High-dose vitamin C. Vitamin C, or ascorbic acid, is essential for its immune-boosting and antioxidant properties, playing a key role in overall health. While adequate amounts of vitamin C from food are beneficial, high-dose vitamin C supplements can be risky for individuals with kidney disease. Here's a deeper look into why high-dose vitamin C is problematic for those with compromised kidney function. Excessive vitamin C intake is processed and excreted by the kidneys, but part of it converts to oxalate in the process. Oxalate can bind with calcium to form calcium oxalate crystals, which can lead to kidney stones, a particular concern for kidney disease patients who may already be prone to stone formation. Kidney stones not only cause pain but can also block urine flow, increase infection risks, and potentially require invasive procedures for removal. Vitamin C boosts iron absorption, which can be beneficial under normal conditions. However, for those with kidney disease who may already be on iron supplements, this can lead to excessive iron in the blood, increasing the risk of organ damage and oxidative stress. Iron overload can be especially concerning for kidney patients, as it may worsen complications related to kidney function. For patients on hemodialysis, high doses of vitamin C can interfere with certain glucose monitoring tests, affecting insulin dosing accuracy. This risk underscores the need for dialysis patients to avoid excess vitamin C supplementation unless advised by their healthcare provider. While generally known as an antioxidant, high levels of vitamin C can paradoxically increase oxidative stress and promote cell damage, especially in kidney patients. It can also increase blood acidity, which can worsen metabolic acidosis, a condition kidney patients are already at risk for due to impaired pH regulation. Vitamin C supplements can interfere with medications commonly prescribed for kidney disease, such as blood pressure medications and certain antibiotics. This interaction can reduce the medication's effectiveness, making it harder to manage symptoms and potentially impacting overall health. For most people, the recommended daily intake of vitamin C is 90 mg for adult men and 75 mg for women, with smokers needing an extra 35 mg. Kidney disease patients can typically meet these needs through vitamin C-rich foods like oranges, strawberries, bell peppers, broccoli, and cauliflower. These whole food sources provide additional nutrients and fiber without the risks of high-dose supplementation. 2. Creatine. Creatine is a naturally occurring amino acid derivative produced in the body and found in protein-rich foods like meat and fish. It's widely known as a sports supplement that boosts muscle growth and enhances athletic performance. However, for individuals with kidney disease, creatine supplementation can pose several risks. When ingested, creatine converts to creatinine, a substance filtered out by the kidneys and a key indicator of kidney health in medical assessments. For individuals with kidney disease, supplementing with creatine can artificially raise creatinine levels, potentially leading to confusion in monitoring kidney function. Elevated creatinine from supplements can cause unnecessary concern or misinterpretation, making it challenging for doctors to gauge the true state of kidney health. The kidneys of a person with kidney disease are already working at a reduced capacity. Adding creatine to the body increases the number of waste products needing filtration, which can place additional strain on these organs. Over time, this added stress can worsen kidney function, particularly in cases where dehydration occurs, potentially accelerating disease progression. Creatine often leads to water retention within muscle tissue, which may increase the risk of dehydration, a serious concern for kidney patients. Dehydration in those with kidney issues can result in electrolyte imbalances, muscle cramps, and other complications that further strain kidney function. Creatine may also interact with medications commonly prescribed to kidney patients, including blood pressure medications. This interaction can lead to reduced efficacy of these medications or amplify the risk of kidney damage, especially when combined with nephrotoxic drugs. Gastrointestinal side effects are another consideration, as some users report nausea, diarrhea, and stomach cramps from creatine. For individuals with kidney disease, such digestive complications can add stress to an already vulnerable system, potentially leading to additional health issues. While creatine is generally considered safe for healthy individuals, its long-term impact on those with kidney disease remains uncertain. Prolonged creatine use may hasten kidney function decline, increase the risk of kidney stone formation in susceptible individuals, and result in unforeseen metabolic complications. While the natural creatine found in foods like meat and fish is usually safe for most kidney patients, high-dose supplementation presents more significant risks. Therefore, anyone with kidney disease considering creatine supplementation should consult a nephrologist. A kidney specialist can offer personalized guidance based on individual kidney health and overall health status, helping to avoid potential complications while maintaining kidney function. 1. Herbal supplements. While herbal supplements are often marketed as safe and natural, many contain compounds that interact poorly with medications for kidney disease or burden the kidneys. Here are some common herbal supplements to avoid. St. John's wort. Often used for mild depression, St. John's wort interferes with liver enzymes that process medications. It can reduce the effectiveness of immunosuppressants, antidepressants, and blood pressure medications, posing risks like serotonin syndrome and photosensitivity, especially for kidney patients. Aloe vera. Though safe as a topical gel, oral aloe vera can lead to dangerous electrolyte imbalances, dehydration, and low blood sugar in diabetic kidney patients. Some studies also suggest it may worsen kidney function over time, although further research is needed. Licorice root. Licorice is traditionally used for various ailments but is risky for kidney patients as it reduces potassium levels, raises blood pressure, and interferes with diuretics. Even small amounts found in candy can cause issues in advanced kidney disease cases. Noni juice. Marketed as a superfood, noni juice is high in potassium, which can lead to dangerous levels in individuals with kidney issues. It may also contain added sugars, which pose additional risks for diabetic patients. Other concerns include liver toxicity and interference with blood thinners, increasing bleeding risks. Understanding how these supplements affect kidney function is crucial, as side effects may vary or amplify in individuals with kidney disease. By knowing which supplements to avoid, you can better support your kidney health and avoid complications. The 8 items discussed: herbal supplements, creatine, high-dose vitamin C, potassium supplements, excessive vitamin A, certain mineral supplements, protein powders, and NSAIDs, can potentially harm individuals with compromised kidney function. Staying informed about these risks and collaborating with healthcare providers can empower kidney disease patients to make safer choices, manage symptoms, and better protect their kidney function. Remember, even small, informed decisions can have a big impact on maintaining kidney health. Thank you for watching. If you found this video helpful, please consider giving it a like, sharing it with others who might benefit, and subscribing to stay updated on future content. We'd also love to hear about your own experiences and any questions you may have, so feel free to leave a comment below. Your health is our priority. Stay safe, take care of yourself, and continue making informed choices for a healthier life.